Hello and good afternoon. I thank all the attendees for taking out time to join us on this presentation. I welcome you all to another webinar from MTBC and our quest to continue educating our providers, our clients, and general population healthcare. Now, this webinar is going to educate our providers how they can improve the patient engagement by using MTBC's PHR application. My name is Athar Maksood. I will be moderating this session. I'm one of the account managers here at MTBC. Now let me tell you, all the participants of this webinar have joined us by using GoToWebinar session. This service allows you to ask questions. You may see a GoToWebinar panel on the right-hand side of your screen. If you want to get rid of the panel or minimize it any time, you can use the orange arrow that is pointing towards the right corner of your screen. This will allow you to minimize the panel and access the screen as much as possible. Now, this webinar has been scheduled for 30 minutes, so if you do have any questions, do not hesitate and feel free to ask as much questions as possible. There is a question section enabled in GoToWebinar panel. All you need to do is just open up the question section, enter your questions, and submit it. And I'm just going to take care of the rest. I will try my level best to answer all the questions at the end of the webinar session, and there will be the time for question and answers. Or in case, if due to the shortage of time, you're unable to get back to your questions, we will be contacting you back by email. Now, just a quick refresher about MTBC before I start. MTBC was founded back in 1999 and is currently serving 60 unique medical specialties in 42 different states across the country. We have 2,000 plus employees with 24/7 operations that enable 24/7 tech support for the products and services that we offer. We have ranked among the Deloitte Technology Fast 500, and we are ranked 500 over 5,000 companies. We have operational facilities in 3 different continents. That means we have got 3 international offices. We are a SureScript certified solutions provider, and we are also listed on NASDAQ. Now, let me just begin by telling you that once the patient is just going to download this application on his mobile phone, if he is an Android user, he can just download this application on his Android smartphone, but if he's an Apple user, he can also download this application on his iPhone, and he runs it for the first time. There is exactly the screen he will be able to see. Now, there are some certain gadgets or some certain features that have been enabled in this application. As you can see on your screen at this point of time, there are some certain features that have been enabled. Right, first of all, as you can see, there are some certain features that have been enabled in this application. Let me just go ahead and introduce them to you one by one. There is the demographics tab that has been enabled. The tab next to that is medication refill. There's also a health history tab, along with the make payments. One of the most crucial and important features that have been made available in this application is secure messages. Along with that, we have got the lab reports tab, and there's also a claim history and appointments tab enabled. We're just going to talk about all these features one by one in detail. So let me just go ahead and start with the demographics tab. Now, once the patient is going to hit the demographics tab, he will be able to view or modify his personal details, such as the address, email, or the phone number. Now, let's say the patient is tapped for the demographics icon. He will be able to view his first name, his last name, his entire complete address, along with the city, state, and zip code. His date of birth will also be made available within the demographics section. Now, if the patient decides to tap on the More button that has been made enabled on the top right corner of the screen, he will be able to view his insurance information. Now, moving on, the next tab that has been made available, the next feature that has been made available in this application is the medication refill request. Now, if the patient taps this medication refill request icon, he will be able to view his medication that has been prescribed to him by his provider and all the pharmacy-related details. Now, once the patient taps the medication refill icon, he will be able to view the list of all the medications that have been prescribed to him by his provider. And as you can see on the top right corner of every medication tab, there is a Call Pharmacy button enabled. If the patient taps the Call Pharmacy button, he will be able to view the pharmacy details, along with the city, state, and zip code. Now, let's say if there's a certain medication that the patient has been taking for quite long and it is about to end, then the patient can just use the call button in order to call the pharmacy and directly place a request for medication refill. Now, moving on, the next tab, the next feature that has been enabled in this application is Health History. Now, this icon will allow the patient to view his entire health history, including the past medical history, past medications that he has been taking, and the immunizations that have been carried out by the provider for a certain unique patient. Now, once the patient taps the Health History icon, he will be able to view the medications, all the allergies, his immunizations that have been prescribed to him by the doctor, and also the diagnosis and procedures that have been carried out by his eligible professionals. Now, let us just talk about another astonishing factor that has been enabled in this application, that is the appointment screen, the appointments gadget. Now, once the patient taps the appointments icon, he will be able to view all the available appointment slots and schedule appointment accordingly, according to his own convenience. Now, once the patient taps the appointments icon, he will not only be able to view the list of all the appointments that he has availed in the past, but also those appointments that are still pending and he hasn't availed yet. Now, if the patient wants to add an appointment for himself or schedule an appointment for himself by searching the available slots for his own provider, he can just use the Add Appointment button that has been enabled on the left bottom corner of the screen. Or if he wants to send the message to the provider, he can use the Send Message button that has been enabled on the right bottom corner of the screen. And that will just allow the patient to send the message directly to the provider. Now, in order to send the message, first of all, he needs to select the provider's name by tapping the Select Doctor tab. Because if there are about 3 to 4 different providers in the same practice, then he needs to select his own respective provider. But if there is only one provider in the entire practice, then his name will be populated automatically. After that, the patient can just type in the subject in the subject box and the message body text in the message box that has been made available. And once doing that, he can just tap the Send button that has been made available on the top right corner of the message pop-up. Now, the Send Message button will allow the patient to send the message directly to the provider, as I've just told you. Now, the next very interesting feature that has been made available in this application is the claim history. Once the patient taps the claim history icon, he will be able to view the claims that have been submitted to his insurance companies in the past. Now, let's say the patient has tapped for the claim history icon. He will be able to view this screen right over here. That will indicate the list of all the claims that have been submitted to his insurance companies in the past. And if there is a certain claim for which the patient confirmed to pay from his own billing account, then that will lie in a different category. And the patient can also view the claim details by tapping on any of the respective claim history. And that is just going to populate the entire details for the patient for that particular claim. Now, if the patient decides to tap the Details button that has been made available on the top right corner of the screen, he will be able to view the claim details. That will include the insurance company's names, of course, along with the diagnosis and the procedures that have been carried out by a certain provider. As I've told you before, one other very important or crucial factor, crucial gadget that has been made available in this application is the Messages, Secure Messages tab. The reason why I'm just tagging this feature as the crucial one is because for all the providers who are on Meaningful Use Stage 2, they do know about it, that there is a certain measure in Meaningful Use Stage 2 that requires the patient engagement. And I'm talking about the secure electronic messages over here. Now, it doesn't matter if the provider is sending hundreds or thousands of messages to the patient. If the patient is not willing to reply, then the provider will not be able to fulfill that specific measure for Meaningful Use Stage 2. So just keeping that in mind, MTBC has designed this application and has made this measure available within this application. So the provider will have an ease out in order to fulfill that measure. Now, once the patient taps the messages icon, he will be able to communicate back and forth with the provider. He will not only be able to see the list of messages that he has been receiving from the provider's end, but he can also go ahead and tap the compose button that has been made available on the top right corner of the screen in order to send a new message to the provider. The patient can also differentiate between the messages that he has read or that are still unread, because the messages that will be unread will be highlighted. Now, another very fascinating feature that has been made available in this application is the lab reports. This icon will allow the patient to view his lab reports along with the radiology reports if there are any. And he can just tap on this icon in order to view all the laboratory reports along with the radiology reports. And it's just going to populate a list of entire reports for that specific unique patient. And let's say, as it has been displayed on your screens at this point of time, that the patient has selected the X-ray report. So that report will be populated in front of him, and he can just view that report accordingly. Now, the next feature that I'm going to talk about is the Make Payments tab. That will just allow the patients to see his personal payment statement, and he can also make the payments in order to clear any debts that he has for any of the visits that he has been conducting with the provider before. Once the patient taps the Make Payments tab or the Make Payments icon, he will be able to view this screen over here. And the only claims that he will be able to see in this screen will be that were tagged or highlighted under the patient responsibility. So he can just go ahead, view that claim, and make the payments accordingly. In order to make the payments, he needs to tap the Pay Now button that is available on the top right corner of the screen. Once you do that, he will be able to enter his account credentials, that is his credit card number and the credit card type. And he can just make the payments in order to clear all the debts that he has. Now, this is exactly how the home screen will look like. If the patient does not want to go to the appointment section in order to create a new appointment for himself, then he will have an option to tap the new appointment icon that has been made available on the home screen, on the top right corner of the home screen. If the patient taps that, he will be able to create a new appointment for himself by searching the available slots for his own provider. Now, let's say the patient has tapped the new appointment icon. Then in the same manner, first of all, he needs to select his provider name. The location will be selected automatically, and after that, he can just select the date for which he wants to schedule the appointment for. He will be able to view all the available slots, and he can just book any one of them for his appointment for the date of service or for the reason of visit. Now, last but not least, there has been one more feature that is enabled in this application, and that is the More feature, the More button. It is just going to take the patient to a whole set of new different options. Let's say if the patient has tapped the More icon, he will be able to view the list of entire different options. That includes the account authorization, That will just indicate that whether the email that the patient is choosing is authorized. The option next to that is add other accounts. The patient will have an option to add other accounts for any of his family members, so they can access the patient's PHR account as well. The patient will have an option to view his CCDA reports by going to Consolidated Clinical Documentation tab. Now, obviously, if the patient wants to reset the password, he can just choose the reset password feature that has been made available. And if he wants to log out from the application, he can just tap the log out button in order to log out from the application. Now, let me just go ahead and incorporate all the questions that we came across during this webinar, and I'm just going to answer those accordingly. All right, the first question that we came across during this webinar session was how a patient can create his PHR account. Now, while adding the information in the patient's demographics tab, the provider needs to enter the email address in the email section that has been made available. And after that, an invitation will be sent to that specific email address, so the patients can log back into their email, follow the steps that have been provided in order to create the account for their PHR application. Now, another provider has asked this question that whether he will be able to use this application in an offline mode. No, this application can only be used while having the internet connection around. So the patient or anybody else who is using this application needs to have the internet connection around in order to start using this application. Now, another provider has asked this question that the data that he has been entering in the EHR and the patient is able to access that on the PHR, on its PHR account, where that data has been saved. So that data is not being saved in the cell phone device or the mobile device that the patient has been using. That has been saved in the MTBC system. So that data is confidential. So you don't have to worry about that. All right, for any other questions that you have in your mind, you can contact us by using the email address that has been provided on your screens at this point of time. That is info@mtbc.com. For all the webinars that have been conducted in MTBC so far, you can just access those by logging on to our website. That is www.mtbc.com/webinars.aspx. And if you want to contact us by using the landline, you can do that by dialing the number 732-873-5133, and the extension is 308. All the queries that will be placed from your end regarding the mHealth applications will be handled by the Meaningful Use team, and the extension for Meaningful Use team is 308. Now, another provider has asked one more question, a question that I just missed out, that whether he will be able to meet the stage 2 patient engagement requirements with this application. The answer for that is yes. If the patient sends you a secure message by using this application, you will be able to fulfill the Meaningful Use stage 2 requirement. Now, that's all pretty much from my end. This webinar will be recorded and available to stream on MTBC's website within the week or so. So for all the participants who have joined us late during this webinar session, you don't have to worry about it. If you have missed something out, you can just access that by just logging on to our website. That is www.mtbc.com/webinars.aspx. That's pretty much from my end for today. I thank all the participants for joining us in today's webinar. I hope it proved out to be an informative and helpful session for all of you. I wish you all a very good day, and you have a blessed day from my end.